So, did you know that an elimination diet has been clinically studied for ADHD? I think naturopathic doctors have been using elimination diets, and by elimination diets, we mean removing specific types of foods. Often we're talking about things like gluten, dairy, soy, sometimes maybe eggs as an elimination diet. This has actually been documented in research, but they don't use the term elimination diet. They actually use the term the few foods diet or the oligoantigenic diet. So, what I've found in my clinical practice is that some children with ADHD respond really well to these elimination diets. The tricky part is that not all kids respond well to elimination diets. I am very, very careful in the way that we talk about food with children. I think it's very important that we are not creating eating disorders in pediatric patients or creating really weird relationships with food. When I do elimination diets with pediatric patients, we often talk about doing an adventure diet for 30 days. We eliminate the most common typical food offenders. And again, this is backed by clinical research that some children have remarkable improvements in their ADHD symptoms when they're eliminating specific foods. The most important part is to eliminate the foods for a certain period of time and then to re-challenge the foods after a period of time. Usually I do 30 days. That way we do not continue to keep kids on an overly restrictive diet that they don't need to be on. For most children in my practice, I find that they're sensitive to maybe 1 to 3 foods. And after doing the elimination diet and their symptoms improve, we can then very tailored identify exactly what food that they are responding to. Most of the kids, even if they sort of miss eating what they had eaten before, don't really want it anymore because after they try it again, they realize their body just doesn't feel great when they're eating that food. So, at least for the older elementary age children and up, they will self-select after the elimination diet to not eat very much of that food anymore anyways. They know it doesn't make them feel good. There are a number of absolutely fascinating studies on this concept of the few foods diet. It is a concept that has not really taken off in conventional medicine, and I feel like that's disappointing. I think it's really difficult for conventional medical providers to formally recognize or formally advocate their families to go on a few foods diet without understanding how to counsel patients through eliminating these foods. The advantage of doing some of these few foods diets as well is that we are really, just by nature of doing the elimination, taking out a number of processed foods for kids. And the research is so clear that the fewer ultra processed foods kids get, the better their attention and behavior outcomes. Right after the COVID era, fall of 2022 and 2023, I started having the highest numbers of ADHD patients that I've ever seen in my clinical career. A lot of children struggling to go back to a normal classroom. I know it's been a discussion of teachers that kids are having a harder time focusing than ever before. We put kids on tablets for 2 years and then, sort of wondering why kids are having a hard time focusing. But I have one case in the fall of 2022. We tried a number of interventions. For almost all children with ADHD, I start them on a high-quality omega-3 fatty acid, usually a multivitamin, and then sometimes we add in either zinc or theanine, sometimes add iron, depending on what their lab studies show. But I often start talking with parents about doing a few foods diet or kind of oligoantigenic diet. This family decided to eliminate gluten and dairy, which I don't always have kids do right off the bat. I usually do have them eliminate additives and dyes for a test period. That's called the Feingold Diet, and I'll discuss that in a minute. But this kiddo eliminated, I think, gluten, dairy, and eggs for 30 days. They re-challenged the foods. She did totally fine with milk. She actually added in additives just fine. But when she had gluten reintroduced, her behavior problems immediately reverted to a very, very severe. So it was an incredibly simple intervention. All of her ADHD symptoms went away with a gluten low or gluten-free diet. And this is not like a celiac level gluten intolerance or, gluten allergy. This is more just like a tolerance to gluten. So, yep, all of her symptoms resolved. The hard part is, and this is a little bit surprising to me, that research showed such a strong association, because in clinical practice, I do not see that all kids respond so well to elimination diets. But some kids who do, it can be a very dramatic reduction in symptoms, and they don't need other interventions. They don't ever need Adderall or Ritalin. They don't need, certainly psychoactive medications. They don't even need really supplements. They just need to eliminate the one or two foods that are really the triggers for those children. And then I do want to talk really quickly about the Feingold diet as well. The Feingold diet, also an elimination type diet. It's very different. It has a little bit less research than the Few Foods diet, or what we would call an elimination diet. What the Feingold type diet does is eliminate just food additives. So it's colorings, preservatives, and other additives. What's really interesting about this is the true Feingold diet also recommends eliminating salicylates for the initial period of time as well. There is almost no or really no positive research for a salicylate elimination diet in children. I have some concerns about eliminating salicylate-containing foods for kids. There's probably a very small subset of children that do well on a salicylate elimination diet, but reducing salicylates means reducing really wonderful, healthy foods in children. And so I feel like that could be a huge downside. So foods high in salicylates: apples, apricots, broccoli, cauliflower, lemons, melon, lots of colorful fruits and veggies that we really want kids to be consuming. And the research is so clear that the kids who consume the most amount of colorful fruits and veggies have the least likelihood for ADHD. So specifically the salicylate elimination component of the Feingold diet, I do not do with children, and I have never found kids to be responsive to that. I'm sure that's a generalization. I'm sure there's probably the 1 in 100 or 500 kids that might respond to a low salicylate diet. But when I'm talking about a Feingold type diet to families in my practice, we're specifically talking about eliminating colorings and preservatives. So especially food dyes are a common trigger for ADHD-like symptoms in children. Those cases can be very dramatic. So when we're talking about like gluten, dairy elimination, kids can have behavior changes when they're reintroducing those, but you have not seen a sensitive kid until you've taken out food dyes and then put them back as a challenge on red food dye. I've seen those kids wig out, especially around Halloween. Kids that otherwise for ADHD are on low coloring diets or low preservative diets for the rest of the time, but then they kind of have them eat everything for Halloween. It can be pretty exciting. So just be cautious when you're reintroducing those with kids, that they could have really dramatic, and I would say sometimes like borderline violent reactions to those food dyes. Again, this is why it's so important we're doing specific individualized medicine, because no, not all children are sensitive to anything, to gluten, dairy, soy, eggs, to food dyes, to preservatives. It is extremely individualized. So to take a generalization and say all kids should avoid XYZ is just not true. And it really needs to be this challenge, elimination portion, and then challenge portion, so that we can identify exactly what the child is sensitive to. I wrote a whole article on the dangers of elimination diets in children. I'm very passionate about that we don't put kids willy-nilly on elimination diets without really understanding the detriments. So there's social detriments to children. There's obviously financial. There's a number of things, nutritional deficiencies, because kids aren't eating then. So we really need to be careful, but it can be so powerful. It can be such a powerful intervention for children with ADHD. Just giving a note of caution, a word of caution after doing this for a number of years with kids. So we're not creating nutritional deficiencies. We're not creating eating disorders. And that the language that we're using is more like welcoming and inclusive, like we're just trying an experiment, rather than saying you shouldn't eat this because it's bad for you. And now we're getting some evidence that a Mediterranean type diet can be used to prevent ADHD. So this is a really fascinating study. They adjusted for things like education level of the parents, economic status, family history of ADHD, and they found that children who had the highest level of adherence to a Mediterranean type diet had the lowest odds of ADHD. So I think that that's really fascinating. Again, when we talk about Mediterranean type diet, we're talking about a diet high in veggies, fruits, beans, nuts, whole grains, truly whole grains, not just whole grain bread and fish. So I think that that could help guide our interventions and hopefully maybe in the future guide some nutritional interventions in the school system as well. Related to a Mediterranean type diet, those of us in primary care might have heard of the DASH diet. So the DASH diet, those of us in primary care might know this diet. It's called the Dietary Approaches to Stop Hypertension. It's a diet that's high in fruits, veggies, whole grains, lean proteins, and again, meant to lower blood pressure. They actually took that diet or a very similar diet and studied it for ADHD, which is fascinating. This is the first I've ever seen taking a dietary intervention meant to lower blood pressure in adults and bringing it in to an ADHD sort of therapeutic intervention for children. So they studied it on children aged 6 to 12 years with ADHD. They did either the DASH diet or a control diet for 12 weeks, and then they rated the severity of symptoms on a Conners scale. And then they did a couple other questionnaires as well, and then they were assessed every 4 weeks. So they did 80 children in the study, and they found that adherence to a DASH type diet improved ADHD symptoms and improved like relationships with other children. It improved social behaviors. It reduced the teachers' ratings of conduct problems in the classroom. So another great piece of evidence for a whole dietary approach for children to help ADHD behaviors.